broadcasting live from Houston, from the space city to the world. You are watching NowMedia Television.
Welcome to NowMedia's premier medical show, Pain Diaries. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine in Houston, Texas. I have a special guest today who I'd love to share. She has an implanted system in her body, which is called Reactiv8 for her chronic low back pain. I'm also going to have another special guest, a doctor from Indiana, who has worked closely with Mainstay Medical, utilizing the Reactiv8 device to help cure chronic low back pain. Also, I have an insurance agent who will be sharing his story on today's show as well. Remember, you can find me, Dr. Suzanne Manzi, at Performance Pain and Sports Medicine. Our website is www.performancepain.com, or you can reach us by phone, 346-217-1111. I have two different locations. Our flagship location is at 4126 Southwest Freeway, Suite 1700 in Houston, Texas, in the T-Mobile Tower. Look for the big building on 59 and Wesleyan. Also, I office in League City, officing out of League City Spine and Sports at 1200 East Main Street. And don't forget, tune into Pain Diaries on the following channels: Houston, 2110, Beaumont, 2710, Atlanta, 2210, Lake Charles, 2110, College Station, 1410, Eagle Pass, 24, Piedras Negras, 24, and hear us in Chicago on 102.9 FM and 104.3 FM in Huntsville, Texas. Don't forget, tune into Spotify, Apple Podcasts, and Amazon Music. And did you know there's going to be over 300 cable companies and smart TV platforms coming this January 2023? How exciting. Make sure you follow us on all your social media and our digital platforms such as nowmedia.com. Please note though, the information in this show is for informational purposes only and is not medical advice. It's not a substitute for professional medical advice, and I urge you to seek medical advice from your physician regarding any medical condition. Reliance on the information provided in this show is provided solely at your own risk. Hello, and I'm Dr. Suzanne Manzi of Performance Pain and Sports Medicine in Houston, Texas, and this is Pain Diaries. Welcome back. Dr. Suzanne Manzi with Performance Pain and Sports Medicine in Houston, Texas. I welcome you back to Pain Diaries on NowMedia Television. As you know from watching previous episodes, medical technology is one of my passions, and innovative devices allow us at Performance Pain and Sports Medicine and other doctors across the entire country to change people's lives. Today, we're going to feature Reactiv8, Mainstay Medical's featured device, which is a cure for chronic low back pain. The amazing thing about this device is it does not just mask the pain, but it aims to alleviate the pain at its root cause. We're talking about chronic low back pain. We're going to talk on how this device can restore your function and reactivate your muscles of your low back. First of all, let's step back. Two different types of refractory chronic low back pain require a different approach. So first of all, what is low back pain? There's two different types. The first type we'll talk about is radicular pain. Ridiculous? No. Radicular is Latin for root, the nerve root. Radicular pain is pain that travels down your legs and can be due to failed back surgery or the reason you needed back surgery in the first place. the nerve root is affected. The nerve can be pinched or be caused by stenosis, which is narrowing of the canal where the nerve comes out of your spinal canal. Now, what are usually the treatments for this? We use medications, surgery, or palliative therapy, such as spinal cord stimulation or an intrathecal pain pump therapy. Now, palliative therapy means it doesn't actually fix the problem, it just masks the pain. And a third of chronic low back pain patients have this, quote, radicular type pain. Sometimes you hear it referred to as sciatica, or just that pain that travels from your low back all the way down your leg. It's very frustrating to have this type of nerve type pain. The second type of chronic low back pain is a mechanical or nociceptive chronic low back pain. Initially, you have an injury, a very small injury to the low back. This could be just a tweak, when you least expect it. What if you bend over and pick your sock up off the floor, and then, oh my goodness, you can't move for 3 days? This might happen once a year, but then it becomes more frequent, and the cycle becomes a cycle, and it happens over and over again with less frequency in between, and it becomes a nuance. This results in a cycle of neuromuscular inhibition. That's your brain signaling your muscles. This neuromuscular inhibition of your stabilizing muscles of the low back can cause the problem. These muscles are called multifidi, or the multifidus muscles. This usually leads to functional spine joint instability, overload, and then pain. So currently, treatment options focus on covering the pain, or are, quote, palliative, whether they be medications, injections, radiofrequency ablation, all things we've talked about on this show that us as pain doctors utilize to help people get better and help their pain levels reduce so they can become functional again. 2/3 of patients with chronic low back pain suffer from this mechanical type pain. So the million-dollar question is, how do we break that cycle? If the problem's due to an injury, again, this is a simple injury. We could then develop arthritis or degeneration of our vertebrae, where your vertebrals' bodies can even slip in front of each other, called spondylolisthesis. It's a big word. But again, it's just a dysfunction of the way your bones are aligned in your spine. Injections that we utilize include medial branch blocks, which are little numbing injections that go over the nerves that go to your joints, facet injections, which are the actual joints of your low back, and radiofrequency ablation, where we actually take heat and cauterize those nerves that go to the joint so your brain doesn't feel the pain coming from the joints anymore. These type of treatments are geared toward covering up the pain and mask the pain. But 2/3 of patients with chronic low back pain are thought to have this type of pain specifically. So after this type of injury, the spine becomes overloaded, and this leads to spine, joint, and tissue pain. What happens then? Our bodies then reflexively respond with multifidi inhibition. Our body wants to respond, but it can't. Our bodies then prevent these muscles from firing, as we're afraid there's going to be more pain. Our brain signals our spine not to fire those muscles because we don't want to feel the pain. And it's all at a subconscious level where your body adapts and makes these decisions at the level of your brain and your muscle connection. This leads to functional spine and joint instability. And then this leads to more spine and joint overload, which then tells your brain you have pain. Then more multifidus muscle inhibition happens, and the cycle just keeps repeating itself. And this is why people that have a low back pain can potentially have more low back pain more frequently with smaller and smaller little injuries. This is the problem, and no one's addressed it in the past. The multifidus muscle is important. The goal is to restore and fix the pain. This is the primary stabilizer of your lumbar spine. This contracts involuntarily. It does this on its own to maintain the stability in the low back. Think of a skeleton for Halloween. When you stand up that skeleton, it just collapses. We don't collapse because we have our muscles stabilizing us. And what keeps our spine upright and erect are our multifidi muscles in our low back. So when there's pain, our bodies reflexively inhibit the muscles from firing. If you don't use it, you lose it, which is the same in the multifidus muscle as well. Sometimes when we don't use this muscle, small amounts of fat can deposit in the muscle over time. Think about your filet mignon versus your ribeye. When you have a filet mignon, you know it's a great cut of steak when there's not much fat in it. But with that ribeye, you want that marbling of the fat inside. Now, this is what happens to our muscle. When fat deposits into our muscle, it's because we're not using the muscle. And so our multifidi turn from a filet mignon type texture to a ribeye type texture. I hope you found this information informative. I'm going to play a little video right now so you can understand what the Reactiv8 device looks like and what it really is.
Mainstay's Reactiv8 is an implantable device designed to electrically stimulate nerves to activate key stabilizing muscles of the lumbar spine. Chronic low back pain consists of an ongoing cycle of muscle weakening, pain, and activation suppression of the core spine muscles by the brain. Reactiv8 is designed to stimulate the nerves responsible for contracting the multifidus muscles. The brain senses the muscle contractions, and in response can trigger restoration of muscle control. With the multifidus again providing joint stability, the continuing cycle is interrupted, facilitating a recovery from chronic low back pain.
The opportunities are endless in helping change people's lives who are suffering. And the Reactiv8 device is one of the modalities we utilize at Performance Pain and Sports Medicine in hopes of relieving suffering, improving function, and especially reactivating the muscles of the low back. Stay tuned for more to come. I'm Dr. Suzanne Manzi here on NowMedia TV in Houston, Texas. And this is Pain Diaries. We'll be back right after a commercial break. Welcome back to Pain Diaries. Dr. Suzanne Manzi here with Performance Pain and Sports Medicine in Houston, Texas. I am excited to introduce Roseanne, a patient ambassador who has had the Reactiv8 device for a few years for her chronic low back pain. Roseanne, thank you so much for taking the time today to come on and tell your story on today's episode of Pain Diaries. Let's start out with a little bit about yourself and your journey with pain management.
Well, I guess the best place to start is I'm a farm kid born and raised in Indiana. I eventually became a college athlete, which is where I kind of started my journey with my lower back pain, which was about 25 plus years ago now. But I had hurt my back before my senior year of college, went to our trainers and things like that and kind of did the normal, sports athletic training, rehabilitation, did everything from heat packs to ice baths, stim treatments, physical therapy and things like that. And then kind of just suffered through everything through my senior year as an athlete. I thought that my pain would subside after I graduated, just given the fact that, I wasn't having the practice every day, lifting the weights, just putting my body through the normal wear and tear and strain that I was doing for the last 4+ years, as a Division I athlete. And to an extent, it kind of, it tapered off a little bit, but it always was a nagging, just a nagging pain. As I got older, then going through my later 20s into my early 30s and then into my late 30s, what turned into a nagging pain, every so often turned into a consistent pain that got to the point where it became unbearable. Went to my family physician and said, this is what's going on, and I can't get comfortable, and I'm suffering through this. What can I do? And, they kind of just did the normal procedure thing, sent me to get an x-ray, and went through the steps, and they said, well, we're looking at your x-ray. You've got some onset of degenerative arthritis, which is normal for your history and, your athletics and things that you've been through, which is, it's normal for what you've got going on. And I said, okay, so, what are my options? What can I do? And they said, well, you're not a candidate for surgery. We can send you through physical therapy, and we can give you some pain. And, basically it was kind of suck it up and deal with it. I did the physical therapy for 6 weeks, 2 to 3 times a week, and nothing got better. And I could not get any sort of relief. I was, Googling everything that I could come up with, did the pillow underneath my knees when I slept at night, between my knees. I got all the lumbar supports for my car, for my work chair, the back braces, the TENS units. I mean, I was doing everything. And then I ended up stumbling across the Reactiv8 procedure and the therapy, and looked into what the process was, what it all entailed, and how the therapy was an actual way to fix and rehabilitate my back. And it was the best decision I ever made. So I've had my implant for almost 5.5 years now. And I've been pain-free for the last about 5 years. So like I said, it was by far the best decision I've ever made.
That's fantastic, Roseanne. Now, were you a part of the studies? Because I know there's about 9 years worth of data now out there. And I was wondering if, were you part of the study, or did you get this done under your insurance?
I was actually part of the one of the first clinical trial studies that came through. I'm in Indianapolis, Indiana, so it was actually done through the Indianapolis Spine Center here. Like I said, I was part of the first clinical trials.
No, that's awesome. Can you tell us a little bit about what the device actually feels like? I know the therapy sessions are usually twice a day when you first get this device for chronic low back pain, and then you can potentially taper that off as you go. What does it feel like, and can you tell us a little bit about that?
Well, anybody who's had back pain, I guarantee that there is a TENS unit that's in their repertoire of devices that they've used to try and alleviate that pain. So the best way I can describe it is basically it's similar to a TENS unit, but it's definitely much more intense. It's a deeper massaging type of a feeling. It's kind of like it actually gets to that pain spot that it seems like you can never quite get to. So like I said, the therapy, yes, as you stated before, when I started it's a 2 30-minute sessions a day. In my journey through this, on going on 5.5 years now, I guess you could say almost to the point where I'm kind of addicted to my implant, because I still run mine daily. I run it every night before I go to bed. And I am a firm believer in, if you don't use it, you lose it. So it's kind of become part of my fitness routine, if you want to call it that. Not, like I said, not to mention it is to the point where it's very relaxing and massaging. So it actually, it helps me fall asleep.
That's amazing. That's really great to hear. I know there's different program options as well. Is that right? Did you switch programs over the years, or have you always used the same type of programming?
Actually, when the whole therapy process starts, I always call them the programmers. I don't know what their actual term is. They're wonderful at kind of dialing in the intensity of the stimulation to basically what I feel comfortable with. And then, it's kind of like any, what I think of it as is, any sort of a muscle strengthening process. I would go back every couple of weeks and, basically turn it up a little more to kind of just get that multifidus muscle, kind of bring the strength back to that. So, I started out lifting a 5-pound weight, and eventually, it's kind of like I moved my way up to get, a little heavier and a little heavier. And actually just had my 5-year checkup in August, September-ish, and I turned it up a little more. So, I mean, like I said, I don't want to lose what I've got going on. So.
Oh, absolutely. So I brought a little demo of the battery. I don't know if you can see it here. This is the size of it. So if you look at it on my palm, it's not that big. Can you actually feel yours where it's implanted?
Yes. Mine is implanted. It's on my lower left side, in my lower back area. My surgeons did an awesome job about just the implant location. I don't ever feel it, if you want to call it that. I mean, it's high enough above my belt line so it doesn't rub. The only time I ever even really notice it is if I sit in a chair that has a really, really protruded lumbar support.
Right.
But it's not like it hurts. It's not uncomfortable. It's just, I mean, it reminds me of the old flip phone, cell phone batteries. It's about that size. But like I said, my surgeons did an awesome job for the implant and the location. And, I don't have any physical quandaries about how it feels or any issues with it.
That's fantastic. I know on the initial research, they were saying, the batteries might last a good 5 years if people do use them twice a day. But now they're seeing, now that they're past that 5-year mark, it's lasting longer. You're still on your original battery, correct?
Yes, ma'am. And I've actually heard that there's a lady who is one of the original clinical trials. I think she's going on over 8 years now and is still on her original battery. So, I'm holding out for it, and I'm hoping, from what they tell me if it gets to the point where the battery does run low, it's pretty much just kind of a plug and play, just to swap out the battery into the new electrodes. And then, it's a fairly simple procedure just to do that.
Oh, absolutely. I do a lot of battery swaps in my practice, and it's only a few minutes where you have to just open up the old incision and you take the battery out and you pull out the little wires that are attached with Reactiv8. There are 2. You take it out, take the old battery down, put a new battery in, reinsert the wires, ensure that they're secured properly and we have the correct impedances, and then we just put it right back in the same pocket that's in the buttock area that you have it, and we stitch you back up. And it's literally, a few minutes. It's a really easy procedure based on, whether the anatomy is simple or not. But again, because the device is so superficial, it's not a very highly invasive type procedure to swap out a battery. Now, you said you're completely pain-free. You're not having any further back pain in the setting of having the Reactiv8 device implanted?
No. And that's kind of, like I said, that kind of goes along with my mentality of, if you don't use it, you lose it. So, wow. I mean, to me, like I said, it's a maintaining of, my fitness routine, if you want to call it that. I have strained my back in the last, 5.5 years. And my immediate go-to is, I go straight back to my therapy sessions. I run them, twice a day. And I have found that, my recovery time is significantly less. Things that, when I would strain and hurt my back would take me a week and a half, 2 weeks to, get back to, feeling like I could bend over and tie my shoes, within 2 to 3 days. I mean, like I said, I'm stimulating that muscle, trying to get a good blood flow going to it. And my recovery time is, like I said, 2 to 3 days, I'm back at it and I'm back to being pain-free again.
That is amazing. That's really amazing. I want to go back a few steps. I know you said it kind of feels like a TENS unit. Now, a TENS unit, a transcutaneous electrical nerve stimulation unit, is something that we do utilize as, on the surface of the skin for people to help with pain. But the Reactiv8 system is very different in the mechanism of action in which this device works. So I just wanted to make sure people understand. So the pulsations might feel similar, but what the device is actually doing is very different. And so the Reactiv8 device is stimulating the nerves that control the muscles that stabilize the spine. And that results in that comfortable therapy that cycles those deep muscular contractions with the goal of restoring your control in the low back. In contrast, the TENS unit is again a palliative type treatment option where we block the painful signals that transmit the electrical impulses through the skin. And again, a completely different sensation and doesn't really address that root cause of the mechanical low back pain that Reactiv8 does. Is there anything else
exactly.
you think important that viewers should know about this device from a patient standpoint? Now that you've had it for 5.5 years, what would you say as a take-home message?
I guess the biggest thing is that, if you've gotten to the point where, you kind of feel like that you hit a dead end, because that's kind of where I was at. I wasn't a candidate for surgery, and, there weren't any options to relieve any sort of the pain, that I was having. And, I started to question myself a lot. I, definitely look into this process and this therapy, and, it answers a lot of questions. And, looking back now, the pain and how it started, and, I can go back to the exact point where I know exactly what I did to originally hurt my back 25 plus years ago. And, just like I said, definitely look into it, the everything about the process and how it works, and restoring, that multifidus muscle, and getting, that the core back in your back. It makes a big difference. And, when you kind of feel like that you ran out of options.
For sure. Well, Roseanne, we really appreciate you being on Pain Diaries today. Thank you so much for taking the time to share your story with the world. We appreciate you and are hopeful that you may be able to also be able to help someone in chronic pain reach out to see if Mainstay Medical's Reactiv8 system is right for them. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine in Houston, Texas. And this is Pain Diaries. We will return after a commercial break. Welcome back to NowMedia's TV show, Pain Diaries, broadcasting here in Houston, Texas, on channel 2110. We are back with Dr. Gentile. I'm pleased to introduce him and welcome him to today's show. Dr. Gentile, since today's episode's all about Reactiv8, we're looking forward to hearing all about your expertise.
Thanks, Suzanne.
Absolutely. So I know you're an MD and you're a pain management physician, minimally invasive spine specialist with Indiana Spine Group, focusing on spinal diagnostics and therapeutics. Like me, our mission is to provide comprehensive, individualized care to people living in pain. So first, just tell us a little bit about your practice and what you do and why you do it.
Well, I'm part of Indiana Spine Group, and we have a practice that involves both interventional pain physicians like myself and spine surgeons. So we treat pain from the very beginning, back pain and neck pain with radiculopathy. And then if they need surgery, we hopefully have figured out where their pain's coming from, and we send it to our surgeons to be treated if surgery is needed. We try to be as minimally invasive as possible. We try to accentuate the conservative treatment efforts, physical therapy, things like that. And we see Reactiv8 as a adjunct to conservative treatment methods, and patients that have had axial back pain that just haven't been responding well to the physical therapy, but just do not have pathology that is surgical in nature.
Absolutely. So what in particular, why do you like to manage patients with chronic low back pain?
Why do I like it?
Yeah.
Well, it can be somewhat challenging at times, but it can also be very rewarding, especially when you get motivated patients like Roseanne.
Yeah, you did Roseanne's implant at your group, which is really cool. You know, we were part of that big study a few years ago,
Yep.
and I mean the results are amazing. I know here in Houston, I'm one of the few docs trained in the procedure here in this big city, and right now my issue's been getting people approved on their insurance. And we keep submitting because there are so many candidates. I mean, so many people have chronic mechanical low back pain. And I'm just excited about low back pain now because I have more options. And options are, I think, are great for patients that are non-surgical. And I know this is a small incision and minimally invasive, so I wouldn't say it's fully non-surgical, but we're not changing the spine in any way, which is huge because I know once people have spine surgery, I tell them they change their architecture. And once you have spine surgery, you can't really go back. With this, it's fully removable, and if they came to that, I know in the studies people were fighting about not having it taken out after they were given that option.
Yep, it's true. I have taken a few out that people felt like they just didn't need anymore. And it was a fairly straightforward thing to take out. But, patients like Roseanne still love to use their stimulators. And, she gets great therapy and gets enjoyment out of using it on a daily basis. And that's more the norm than the patients that want it taken out.
Absolutely. Have you seen any complications with this type of treatment thus far?
The only complication that we've seen is a minimal infection that responded well to oral antibiotics. Didn't have to be explanted. I would say another complication might be that it just didn't help the patient. But those are very few and far between because we carefully screen each patient before they get this device.
Yeah, I think some people have limited expectations because, when you get a device like this, you just want instant gratification. Like, I just had this thing in my back and now where's my pain relief? Well, unfortunately, this one doesn't work like that because it's actually functional and it's changing the muscles and, getting muscle to hypertrophy and taking it from atrophy to now active muscle tissue again. It takes time, anywhere from 3 months to 6 months, even longer, depending on the patient's status. Have you had to manage those kind of expectations in your practice?
Absolutely, yes. People, as you know, they want something very quickly, and we have to coach them up front that this is not going to be something that helps them immediately. It may take several months to even a half a year to really be helpful to them. So you really have to coach them and tell them to be patient with this, with the device and the therapy. Even physical therapy, when patients come in and we put them through physical therapy, we tell them, look, you're probably not going to feel better right away. You might, in fact, feel somewhat worse initially, and you just have to something you have to stick with. Definitely.
Absolutely. When you do an implant, what kind of follow-up do you have with the patients after you place this actual device in them?
We typically do the implant and then see them back 2 weeks later to activate the implant.
Okay.
So we'll get follow-up x-rays just to make sure the leads are correctly placed and they're similar to where they were in the operating room when we put them in initially. But those first 2 weeks are just to have them heal up from the surgery and make sure there's no infection. We do keep them a little bit quiet as far as activity because we don't want the leads to migrate, although that really hasn't been an issue with any of the patients we've had. I don't think I've seen any lead migrations in my patients.
Yeah, the migration, I think, with the way the leads are tined, so if people don't understand, it's like a piece of spaghetti, and then there's 2 different sets of prongs that prevent movement from either direction.
Correct.
So that
kind of like a grappling
they don't move
hook
in the tissues. But I mean, lead migration, even with leads that don't have tines, we as pain doctors have found ways to secure them so they don't have forward or backwards migration. So with this double-edged tine device that is on the Reactiv8 leads, I think people have a much lesser chance of having migration. But I mean, that makes sense to allow it to heal in before you let them do anything.
Yes.
Do most of your patients like the device? Have you had great results so far?
Yes, we've had great results with the device so far. But again, you have to carefully pick these patients. Now, a patient like Suzanne, actually, she did have some pathology in her spine that some people would potentially operate on. I mean, she did have significant disc degeneration, I believe at L4-5, um, with modic changes, end plate erosions. And there are some people that will operate on patients like Suzanne, or Roseanne, I'm sorry. Um, but, she did have, multifidus wasting. She did have a positive prone instability test. And this was certainly the lesser invasive procedure than, a spinal surgery, a spinal fusion surgery.
Absolutely. And the way the leads are placed and where the battery is doesn't preclude anybody from having spine surgery per se.
Correct.
If something does happen, like let's say somebody blows out their disc, if they're in some kind of trauma and they need surgery, they can still have that. The device,
Correct.
again, is more superficial. Even though it goes over the nerves of the spine, it's on the posterior part of the spine. And so it can be easily removed, or it can be left there and people can have other types of treatments to their discs or their spine if needed. I think a lot of other misperceptions we need to clear up about this device is you're still going to feel pain if you have something happen to your spine. It's not. It's just making the muscles strong again to support that posterior column of the spine where your muscles are. I describe it to people as like the internal brace, the internal bracing system that gets weak in everybody. What kind of how do you describe it to patients? What do you look at when you try to talk to people about why they would benefit from this?
I tell them that it's like artificial physical therapy for their back. So it's therapy that they don't necessarily have to do, the exercises they don't have to do because the device is going to do it for them. And they are somewhat reluctant because we have to put a battery in their back, but I have not had any patients that have really complained about that. The discomfort from the battery is minimal. I think that with time and with advances in technology, the battery will continue to even get smaller, potentially be even rechargeable, so that battery changes, which I haven't had to change out a battery yet for any of the patients we've implanted due to battery exhaustion or malfunction. So I think with time, battery replacement might be, pretty negligible in these patients because you'll be able to recharge it at some point.
Yeah, that would be great. But the fact that they thought the battery life would be about 5 years for the 2 sessions a day of 30 minutes each, it's definitely even extended past that.
Yeah.
I know there's people out there with 8+ year battery life, which is fantastic. Even though a swap out's very simple, Roseanne and I kind of talked about that earlier. This little battery here, it's basically take it out, put a new one in, reconnect the leads, and sew back the pocket where the original one was. Or if you need to move it, that's possible too, based on the patient's anatomy change, or if they want it in a different spot in the future. It's all about patient comfort and accommodating what the patient needs for their spine and their pain levels.
That's right.
So tell me how the landscape has changed with regards to this treatment of chronic low back pain. I know we have the Reactiv8 device now. I mean, the past few years, our field I feel like it's dividing, just basic injections and minimally invasive. Have you felt the same in Indiana?
You're absolutely right, Suzanne. We have more options to treat back pain now than we have ever had. Reactiv8, Intracept, even some potential with spinal cord stimulation. So I feel very confident that treatment of back pain will be much better for us in the future and for our patients.
It's definitely an exciting time to be a pain doctor. I know we just have so many options now available to us. Even if you look at 5 years ago, even 2 years ago, I mean, the opportunities that we have to help people, it's just changed significantly. And we're being trained on, higher level treatments. And, yeah, there's still injections and, you know, the basics, which is fine. And some people just can get away with that and feel better with those kinds of things. But at least we now have the ability to offer our patients, you know, cutting edge technologies that, you know, just keep popping up year after year. It's been fantastic.
I think the biggest challenge we're having right now is just educating the insurance providers. You know, they still look at it as spinal cord stimulation, which is like covering up the pain. It's not really treating the back pain.
Right.
Reactiv8 have to think about it completely different, in a different manner. You're actually trying to rehabilitate the spine. And when we talk to some insurance providers, they go, well, you know, they're used to us doing a trial, a percutaneous trial with spinal cord stimulation, and that's just not feasible or really possible with Reactiv8, because you're not going to see results immediately. It's going to take some time. You know, insurance companies are very slow to catch up with this. But I think, you know, the more patients we are helping, the more studies we put out to show its efficacy, we're gonna change their minds.
Oh, definitely. And I've just seen over the past year of me submitting patients under insurance. I mean, I would just get denial, denial, denial. But now I'm like, oh, this one's approved. Oh, okay. Well, I can't wait. I hope we can get that patient on the table real soon, because again, we have this technology and I'm ready to jump in and utilize it. Just setting expectations that no, it's not going to be immediate. It's going to be like doing physical therapy for a few months. But yeah, in the grand scheme of things, it's considered a peripheral nerve stimulator, not a spinal cord stimulator, as it's going over the medial branches of the lumbar spine, which then go towards that multifidus muscle to make it activate. So anything else you want to add before we say goodbyes for today?
I think patient selection is key. I think I alluded to that previously. I don't think you need to worry about necessarily the pathology you see, such as arthritic facets or degenerated discs. They just really need to have some indication of multifidus dysfunction, either through atrophy of their muscles on the MRI that you can see with fatty infiltration, or a positive prone instability test where their pain is relieved with activation of their multifidus muscles. So those are, I think, the key features that really will tell you whether this patient's going to respond well. And you know, you don't be afraid about, you know, patients that have been having pain for many, many years, because many of these people are like that. Many of these people have been, you know, suffering with this back pain that just has been unrelenting, and they haven't been able to get help from other traditional methods. So, you know, they're out there. Sometimes we don't see them come into our office because they're done looking for treatment.
Right. Yeah, there's a lot of people that come to me. They're like, I've had this pain for 30 years and I haven't been able to get rid of it. I was like, well, you're in the right spot. Let's see what we can do.
Right.
They're like, what do you mean? And I tell them, you know, the past few years, it's just been exponential on, you know, what I have to offer people now. So I give them hope, and I know you do too. It's exciting.
It is.
So thank you so much. I greatly appreciate you being on today's show with us. If you or a loved one is suffering, please know there are options. Find your nearest pain expert in the field to see if you are a candidate for amazing medical technologies like the Reactiv8 device by Mainstay Medical, which can change lives for the better. This is Pain Diaries, and we'll be back after a commercial break. I'm Dr. Suzanne Manzi. Take care of you so you can take care of business. Hi, Dr. Suzanne Manzi here, back at Pain Diaries. I'm going to introduce our benefits specialist, Dana Oliva, now to talk about insurance.
Hello, this is Dana over at Alliance Insure Group, where we help protect our clients from unexpected medical costs. Today on Pain Diaries, I'll be answering questions from our viewers. Today's question comes from Will W. I have pre-existing conditions. What is the best solution to get covered? Now, this is a great question as well. And depending on the severity of the income level, options may be available through the marketplace and or private health coverage. If it's a severe pre-existing condition that involves the heart, nervous system, or insulin dependency, for example, you have two options. You can either go with an employer in group insurance or through the marketplace. I personally would recommend that you avoid short-term plans. They can be underwritten at the time of the claim, and then they can deny you coverage, okay? If you'd like to contact me via email, I can be reached at dana.oliva@allianceinsuregroup.com to discuss this in more detail based on your unique circumstance. I may be able to offer additional guidance. This has been Dana with Alliance Insure Group, and this has been Pain Diaries.
Thank you, Dana. We appreciate you and the Reactiv8 team for being here with us today, providing a world of insight. Dana, thank you for being our benefits strategist. We look forward to seeing you again on our recurring segment on the show. And Reactiv8, a new medical technology breaking ground for chronic low back pain. We look forward to seeing you at 2110 on NowMedia TV and across all platforms and channels. I'm Dr. Suzanne Manzi, and this is Pain Diaries. Take care of you so you can take care of business.
This has been a NowMedia television feature presentation. All rights reserved.